Hello, and how are you all this evening? So, I wanted to take this time to introduce myself, and everybody knows who I am, probably, because you probably see me in so many shorts. But I am Dr. Luella Ayoka, and this is My Medical Moments, and I'm coming to you live today. And I wanted to answer some of your questions. I know today we were discussing Um, well, not discussing, but today I was talking about hypertension and I was talking about diabetes, and I wanted to see if anyone had any questions about it. As a lot of people do, they always ask me about these two particular conditions, and it's a hot topic. And a lot of the things that I do share normally people do, and it's been proven to get better with it. So let's see. So far today, I was talking about diabetes and I was talking about the diabetic medication. Well, a lot of people get very confused about the diabetic medication. And so I have a lot of people telling me that I want insulin, doc, I want insulin. And when they talk about insulin, a lot of times they're talking about something different. They're thinking that all injectables are insulin, so they call it insulin, which all injectables are not, as I was saying that earlier. Injectables can be in many different forms. Right now, on the market, there are two different forms. So, two different types of injectables. You can inject one of the types weekly, or you can inject it daily. Now, there was another type that in the past that you can inject daily, and people were using it, but we haven't been prescribing it very much lately. So, in any event, I wanted you to make sure that you know what kind of medications that you are actually injecting. And that would be something that we can talk about if anybody had any questions today. Um, so, I had somebody ask me to talk about type 1 diabetes, and I wanted to give a little bit of distinction between the two. I don't know if you've heard this, but I'll let you know. So, the common theme is that type 1 diabetes starts when you're younger and type 2 of diabetes start when you're older. Now, that is the very simple version of it because it can become more complex than that. Sometimes in medicine, contrary to popular belief, we have found people that are inverse of that. And that has happened where people have type 1 diabetes and they are diagnosed at a later age, and type 2 diabetes, they're diagnosed at a younger age. And then there are variations to that. Diabetes come in all forms, shapes, and sizes, meaning there's another type of diabetes that's called diabetes insipidus. And there's another one called bronze diabetes. So there are a lot of different forms of it, but a lot of it pretty much deals with uh, hormonal or sugar regulation and how our body utilizes our hormones and our sugars. Um, it's very important because you have an organ in your body which is called a pancreas. Organ in your body that's called a pancreas is responsible for giving off insulin. How about that? Insulin in your body, natural insulin to break down sugars, okay? But also the pancreas has other hormones. So there's other hormones called like glucagon, like peptide. There are other hormones, other peptides, other hormones, incretins. There's a lot of different types of hormones that the pancreas can give off. Now, the pancreas, just like any other organ, just like your heart can fail, just like your lungs can fail, just like your stomach can fail, just like your brain can fail, just like your legs can fail. So, if not that legs are organs, but just letting you know the organs in your body, the viscera, we call the viscera, but the organs in your body, they can become dysfunction, of course, when you have a condition or you have a disease. And so the pancreas is one of those organs. And it is important, right? Because a lot of people are coming up with diabetes. And so when you have a problem with the pancreas, its machinery is not working. Um, And a lot of times in the type 1 diabetics, if not all, they actually don't have the true machinery, meaning that their body thinks that their pancreas is foreign. It means that it's not a normal part of their body. So what the body decides to do is it decides to attack the body. And then when it decides to attack your body, that way you can't formulate all of the hormones and the things that you need to break down sugars. And thus, that's what happens. And thus, unfortunately, then you definitely don't have what it takes to make insulin. So, what we have to do in type 1 diabetes, we have to actually replenish insulin. We have to actually give you insulin. And that's the reason why type 1 diabetics use insulin. They inject it, they give themselves the insulin that they need that will help them to eat sugars, to help them eat what we say carbohydrates. Now, carbohydrates are sugars. You probably didn't know that, but some people do. Some people don't. Let me tell you something. If you didn't know, alcohol is a carbohydrate, so it breaks down into sugar. Okay? So, in any event, with type 2 diabetes, what happens in that instance is that the pancreas now is starting to kind of shut down, would I say? So, it's like you have this machine, you have this engine in your car, and you run it, 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 and the engine gets tired and you have to replace the engine. So it's not that you don't have the machinery, like it's not destroyed like it is in type 1 diabetes. In type 2 diabetes, it's not destroyed all the way. What it is just getting tired and it's overworked, overworked. Of course, fat sitting on your pancreas, fat sitting there, it's getting tired. It's like, oh my gosh, I'm getting worn out. We're worn out because I'm fighting so much. You're eating so much sugar. You're drinking so much of the sodas and all of the sugary drinks. And oh gosh, you keep loading yourself and loading yourself. And your pancreas just like, you're overworking me. Why are you doing this to me? So it starts to shut down. And that's why we see it a lot in people who have problems with their weight, because a lot of times when it comes to the fat content, it's not the outside per se, it's the inside. It's the fat that's sitting on the organs that make it just calm down and not really want to work like it should. And then, like I said, you have variations of this of the theme. So diabetes insipidus is another type of diabetes that operates in the brain, and it comes from hormonal regulation. And people have a problem where they have actually urinate a lot or they don't urinate at all. It depends, okay? And so that can happen, or they get thirsty a lot, or their thirst mechanism is off because it's a problem with the brain. So this is the different types, and then there's different types of treatment for diabetes insipidus. So it's not just that straightforward. I know you're like, well, I thought it was, it can be more complicated than that, but I'm trying to simplify it for you. I'm trying to simplify it so that you'll know. Because when the doctor comes and tells you that, oh, it's type 1 diabetes, and you're like, what? Okay, here, take this insulin and inject it. And then the other type of medications that are out here, and they say, here, use this medication, or they give you insulin because of the type of diabetes. That's a caveat. That can happen. That happens a lot, especially when your machinery shuts down so much and it can't work so much that it pretty much stops working at all. So just like your engine can run out, boom, 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 and it's just done. And then you can't, no matter how much oil you put in it, no matter how much, how much you try, the engine just doesn't move. It doesn't move. So then you have to replace it. And sometimes there have been type 2 diabetics that had to be on insulin forever because it just ran out and burned out. So I just wanted to give you an excerpt. Thank you for joining me. I didn't want to go too far today. Thought people would have questions, but I guess not. So I'll keep doing this and these health talks, and hopefully I'll get some people that want to ask some questions. I'm here again. I'm a board certified family medicine physician. My name is Dr. Luella Ioka, and this is such a pleasure to do my medical moments. And I wanted to get into more subjects, which I will. Please go and subscribe to my YouTube channel, and also you can check out my website at mymedicalmoments.health. So I hope you are having a very good evening. I hope you had a happy, healthy day, and I will see you tomorrow. We will do this again. Not a health talk, but you'll hear from me on another subject. maybe I'll expand a little bit more on diabetes. We'll see.